Welcome to the Optimal Bio podcast. At Optimal Bio, we don't just balance your hormones, we balance your whole body. Our conversations range from nutrition to medicine with an emphasis on wellness tips to support your health journey. If you like what you hear, find us on the web at optimalbio.com and follow the podcast so you don't miss an episode.
Thank you for joining another episode of Optimal Bio's podcast. Today we are discussing female health, specifically perimenopause, menopause, and postmenopause. And we're so lucky to have Irene with us, who is the provider in the Southern Pines office and then sometimes the Cary office.
I'm glad to be here.
Irene presented for the providers and for the Optimal Bio team last Tuesday on this. I don't think this is perfect. We need a podcast on this. So excited for us to talk and guys learn all about female health. Because I think women, men, everyone does not realize and understand female health, especially when it comes to hormones and specifically perimenopause, menopause, and postmenopause.
Definitely. And I think it's important for both the man and the woman to know.
Agreed. And it's not just hot flashes and they go away, right?
No. There's so much more to it. So much more.
So much more. Selfishly, I'm so thankful I work here because I'm never going through any of this because I know, one, what's going to happen, and two, that there's a solution.
Yeah, and that's why I think it's important for us to talk to the younger generation, like our daughters, what to expect. So when they go in, they have that knowledge and they're not told you're all right. You're too young.
You're too young. Exactly. Let's start with, I would say, anatomy, and then we kind of build up from that way.
Okay. So the ovaries, that's where I'm going to focus on because it's the fundamental role in reproduction and the production of the hormones. They're these two almond-sized, they're endocrine glands on both sides of your uterus. And they do grow during pregnancy, but they also shrink as you get older, around age 30. And each of the ovaries contain several ovarian follicles. And the follicles, basically, it's like a sac filled with an immature egg. And there's depending on how old the female is, these follicles are at different stages. So the follicle itself, that's kind of the most important, I would say, part of this whole thing. It is, again, it's just a small sac and it's got an immature egg in there. And initially it starts out as these really flat, they're called pregranulosa cells surrounding this immature egg. And those are formed when the 22nd week of pregnancy in the fetal ovaries. And they just kind of stay there. When we're born with all of our eggs, right? Now, once you hit puberty, though, those little flat cells, they start to turn a little bit more round, if you will, and surround that follicle. And this little process right here, from primordial to primary, there's no need for the gonadotropins like the FSH and LH, okay? However, once you start maturing even further, that's when you're in need of the FSH and LH for the maturation. The granulosa cells, they have FSH receptors. And so when your FSH starts stimulating it, then they grow and they release a steady amount of estrogen. And then one kind of there's several of them every month. One kind of gets picked to be the primary or the one that's going to mature fully. And then once that one gets as large as it's supposed to, it releases a higher amount of estrogen, which then causes the LH surge and then ovulation. Now, ovulation it's when your follicle basically kind of bursts and lets go of the mature egg. Now, the follicle will close off and become something called a corpus luteum, and that starts secreting your progesterone, right? So different times of your cycle, you have different moods. In the follicular stage, when your estrogen's kind of steady and rising, you usually kind of feel pretty happy, sociable, things like that, because estrogen, it's associated with serotonin production. But then during your LH surge or ovulation, that's when your libido is going to be the highest. That's when you have more self-confidence usually, Immediately after that surge, though, those levels drop. Like the ovulation, they drop. So then shortly after ovulation, sometimes you can get a little irritable and like tired. But then progesterone picks up and you're feeling relaxed, no anxiety. So it's like a nice mood circle throughout your whole entire reproductive years. So those hormones play a huge role in just keeping us, I guess, level, if you will, for the most part.
Vestibular, right? Sea level.
The issue with that is like if you need those hormones to feel like that, what happens when they go away?
Exactly. Also, too, I don't think people realize how much women, girls, teenagers' hormones fluctuate every day. And so one, like personally, it makes you feel better because you're like, okay, this is why I'm feeling this way, or how can I fix it? Instead of thinking, why do I feel like I'm crazy today? And it's like, oh, well, my progesterone just dropped. This is why it could be doing that.
Definitely. Our hormones are like so key in like our mood. And I don't understand why more people aren't like taught that or educated on, let's look at this level really quick, especially in perimenopause. Like, hey, let's maybe take a look at this first before we start on A, B, and C medication.
Right? Like how many patients do you see that are in perimenopause, menopause, and they've gone to their GYN or their PCP and have never gotten their blood work done?
Oh, I can't even count how many.
I feel like it's rare. It's like when you hear that they did get blood work done, it's like, that is great.
Yeah. It's amazing. Or they'll just be on these medications because they were told they were too young to feel this way. And I'm like, well, perimenopause can last quite a bit. So
exactly, which I don't, because when you're younger, everyone seems old to you, right? If you're like, and then once you start getting, late 20s, 30s, you're like, wait, everyone's young. Because when you think of menopause, you're like, oh, you're so old. But then once you realize, oh, it can start in your 30s, it comes pretty quick.
I mean, they're not menopause, the average age of menopause, if you really think about it, that's not like super old, 51.
No.
Yeah. And then that's just that average. You can have it a little earlier, a little later, but before that, you have like anywhere from 4 months to like 10 years plus of perimenopause where it's all over the place.
Exactly. So let's jump into perimenopause. Like, when can it start and what are those symptoms?
There are so many symptoms. And honestly, it can start, depends on when you're going through menopause. So it can be really like even in your mid-30s, late 30s, you can start having this. The onset of perimenopause is considered like your first irregular cycle after it's been regular, of course, during puberty, when you first start, it's slower regular. But I honestly think that sometimes perimenopause with the symptoms and just overall everything, to me, it seems worse than kind of flatlining out menopause, just because it is such a roller coaster. You really never know what you're going to get. In the beginning, typically what happens is we have an ovarian reserve. Like I said, we are born with a set amount of eggs. We don't make any more. So as the reserve gets lower and lower, then our cycles tend to get a little more irregular. In the beginning, we're producing estrogen because we have these follicles, but you don't always ovulate, so you don't always get progesterone. So first symptoms are typically more anxiety, more like insomnia, things like that. The problem with that is like typically perimenopause and these mood symptoms happen when women, their children are like of college age, if you will. So they're, empty nesters now, or their career. So they're associating it with these changes when it's likely some of it has to do with their changes in their hormones.
Or they go to their doctor and they say, oh, you're too young. Oh, it can't be. Here's medication.
Every time. That's why it's super important. Always ask when their last period was. ask them, how's any changes in that? And sometimes in the beginning, there isn't any changes to their period. Maybe it's just a little lighter, but maybe there's no real noticeable changes. But the sleep, the mood, and then there's several really random symptoms that people really think they're going crazy. Like one of them is brain fog, and everybody thinks like, oh, you just like the mental clarity. But no, you'll have words in your brain and you literally cannot get them out. Or you walk in a room and you don't remember why you went in and things like that. And women are like, I'm anxious, I'm this, I'm that, I'm losing my mind. But really it's the drop in your hormones. There's Lisa Mosconi. She's done wonderful studies. But if you just look up any of her PET scans of the brain of premenopause and perimenopause in particular, and then postmenopause, in perimenopause, there's even less of that energy metabolism. It gets a little bit better once you're postmenopausal, but it's it's shocking, honestly.
It is shocking. And I would Google a picture of that because it really shows when your brain is lighting up and when it's not. And I think it really helps put it in perspective, okay, what are hormones doing to my brain or the lack thereof?
Yes. And see some of the other symptoms like heart palpitations. Okay, I'm not saying if you have a heart palpitation, don't go get a cardiac workup. But when you're perimenopausal, like with the estrogen plays a role with that SA node, which is kind of like the pacemaker, if you will, the heart. So changes and fluctuations can cause you to have palpitations. And then, of course, with the anxiety, increased heart rate. So lots of times people will think there's cardiovascular or something going on. That's one of the other common ones. Itching skin. And sometimes, yes, due to the dry skin, because estrogen does, production of the collagen and things, but not always. Sometimes there's these little electrical, they say it feels like bugs are crawling on their skin. And it's just because of the estrogen and the nerves. Ear itching, like internally, like people will come in like, I don't know, my ears won't stop itching. Or ringing, losing your balance. We have a ton of estrogen receptors in our inner ear. So those are some of them. It's just, there's so many bloating. I could keep on.
Right? Muscle, joint pain, weight gain, hair.
Voice changes, like your tone drops and you get like dry throat because we have estrogen and progesterone. There's like pictures of the differences of your vocal cords pre and post menopause. It's insane. Now, one of the things when I was researching some other stuff, suicidal thoughts, because you have all this stuff going on. You think you're going crazy. People are telling you you're fine. You're too young, things like that. There's plenty of studies that have shown like ages 45 to 54 in women, they have the highest suicide rates. But if you go to like the CDC website and you kind of look over the last 25-ish years, you can see like a significant increase in that particular age of women committing suicide. And also there's a good little bump right around the end of 2002, beginning of 2003. And that was when the Women's Health Initiative kind of put out that estrogen caused cancer and hormones were completely pulled off and pulled away from patients. So I just thought that was quite interesting.
Especially when I feel like, with suicide, it's more like they talk about like the rates in men or a specific subset. You don't really hear about women, which I feel like is a lot of women's health, but really showing like the peak of it. And maybe, of course, there's many pieces to it, but showing, okay, also what's going on during that time of a woman's life.
Yeah, that was kind of eye-opening.
And then what kind of like physical, symptoms, like under like pelvic health? Because people talk about like symptoms, like day-to-day symptoms, brain health, bone health, but what about, like pelvic health?
So when first drop in estrogen, you're going to well, first the periods are going to stop, right? But everybody always just correlates that to the uterus. But the actual vagina also gets thin and dry. So pain with intercourse, bleeding after intercourse. But that drop in estrogen also, our pH isn't as acidic anymore. So then chronic UTIs, chronic BV, what are they treated with? Either an antibiotic or prophylactic, they're being treated after they have it or prophylactically. And we all know like antibiotics in our gut don't go well, and we need our gut microbiome, right? Easiest solution, replace what's not there, even if it's just a little estrogen there. I mean, chronic UTIs and sepsis in the hospital, it blows my mind. It really does.
So much is preventative. So much.
Yes, so much. Prolapse, because of the drop in estrogen, but also testosterone, the muscles, the atrophy. So that's another thing people don't realize. We make more testosterone than estrogen. Our follicles make testosterone, and then via their aromatase activity, it is converted to estrogen. We don't necessarily make estrogen as women. So testosterone is not a male hormone. It is a human hormone. Like, same thing with estrogen.
And that's why when I tell people that all of our female patients before perimenopause, menopause, whenever they individually may start getting estrogen with us, they only get testosterone. And they're like, what? And I'm like, women need more testosterone. And then I'll be like, I want testosterone. And they're like, wait, what? I'm like, exactly. It is a human hormone. It is not a male hormone.
No, I know. And it has the same, it does the same thing. So let's replace just estrogen, but we're still going to have muscle atrophy, all the things if we don't replace our testosterone. So.
Exactly. When I'm like, testosterone has 500 functions, estrogen has 400, progesterone has 300, people look at me like, and I'm like, no, like, what does that mean? Like, every cell in our body has a testosterone receptor. Without these three hormones, our body is not going to be able to function properly.
Yeah, it's like it needs, somewhere is calling for it at all times. So
exactly. That's why individually our symptoms might show a little differently because our body's just going to show up differently, but we're going to have symptoms. But sadly, a lot of the preventative aspect, we may all, be across the board. Like, why do women get dementia so much more than men? Of course, there's many different theories, but one can say a lot has to do with hormones.
I would definitely agree. And the studies now, the new ones with the PET scans, are kind of showing more and more of that. It's so scary to think about.
It is so scary. So I'm like, I'm on testosterone, 1, fatigue, like my day-to-day, the fatigue. And then 2, if I could protect my brain, like, why would I not protect my brain?
Exactly. I'm all about quality of life. Like, if I'm going to live to be like 80, I want to have quality of life. I want to live.
Or how you even mentioned UTIs. People don't realize how many elderly women are in the hospital with UTIs and then get sepsis, and then they eventually passed away.
Yeah. And it could have been easily prevented. Easily.
Exactly. So how would you diagnose perimenopause?
That is, you can only diagnose that via symptoms. You cannot do labs on that because they will be all over the place. One day they'll be completely normal. Next day FSH might be elevated. But there are a couple of things that if someone comes in with some random symptoms, of course, like the palpitations, cardiac workup, right? But we should definitely do a full thyroid panel and check prolactin. Because one, underfunctioning thyroid symptoms are very similar and often overlap, but also a full thyroid panel, like not just TSH and T4, because again, our T4, it converts, reverse T3 and T3, and our gut, especially as, with the loss of our hormones, a lot of that converts in our gut. So I think just in general, we should be checking it, but especially then. And then prolactin, because there are a couple things that can cause a prolactinoma, can cause some hormone changes. Now, the difference between perimenopause and menopause, super important. Okay, perimenopause, like I said, maybe they have regular periods in the beginning and then they become irregular. They can go, months without a period, but if it hasn't been a full year without a period, it is considered menopause. So if someone goes 9 months and then they have a period, nope, they weren't menopausal or postmenopausal. They're still perimenopausal. Menopause is a single day in time. It literally marks the 12th month from the last menstrual period. That's it. After menopause, that one day, you are considered postmenopausal. There's no menopausal. It's perimenopause, menopause, postmenopause. And even for menopausal, postmenopausal, you can do labs for them. Their FSH is going to be elevated. Estrogen's likely going to be low. And you should probably still check their thyroid and testosterone then too.
Yes. And, speaking, we just mentioned the roles of testosterone, estrogen, progesterone, but, what would you say some of the main functions of those three are?
All three of them are anti-inflammatory. So when we don't have them, our body becomes pro-inflammatory. So chronic inflammation, as we all know, is linked to, oh my gosh, how many diseases? Alzheimer's, I know, all of them, diabetes, cancer, everything. So that alone to me, I'm like, please, just give me my hormones. For women, autoimmune diseases, right? Let's see, progesterone, when you have low progesterone, like I said earlier, poor sleep, anxiety, things like that. Estrogen or low estrogen, vaginal atrophy is probably one of the more common and most painful ones, because if you have vaginal atrophy or the thinning and dryness down there, painful intercourse, there's been studies that show menopause with increased risk for divorce and things like that, because marriages and relationships start to suffer there. So it's not just physical, it plays a role in your whole life, Testosterone, libido, of course, but muscles, brain health, again, anti-inflammatory, of course. So there's just so many to name. If you could see a picture of habits, just goes on and on.
It really does. So then, speaking about, perimenopause, menopause being a day, and postmenopause, what can we do to help? I think one main point too is we talked about how perimenopause can start in our 30s now. And there's a lot of research that is saying that it's starting so much earlier because of the endocrine disruptors. It's just wreaking havoc across the board on our hormones. But, what can we do to help ease the symptoms or, stay balanced to hopefully help with the symptoms, but really in that preventative care too?
So there are some lifestyle things you can do, right? Of course, eat a diet that's anti-inflammatory. So fatty fish, lean meats, things like that. You probably want to get some exercise, cardio, but strength training and balance training too. Because falls, postmenopause and mortality, not the greatest.
I think it's becoming now compared to say 10 years ago, the importance of strength training, especially for women, building our muscle and our bones and our balance, super, super important.
All that. And I was talking to someone earlier about that. We need estrogen for our bones, right? But testosterone, we can have strong bones, but we don't have any muscle. We need both. So,
or you think about what in your body is muscle. It's oh yeah, muscle keeps you alive, like your heart.
That's a pretty important muscle. Yeah. Decreasing your stress, because high cortisol definitely suppresses testosterone, estrogen reduction, all that. So mindfulness practices, whatever you find that keeps you calm. Self-care is super important for you. Find something you like to do just for you though, not, oh, I'm going to start this craft because my kids or somebody wants it, right? So diet, exercise, and sleep. And then supplements. We should try to get our nutrients in our food, but it's a little difficult now, especially with our food supply. So collagen, fiber, omegas, probiotics, of course, for our gut, vitamin D. Cannot forget vitamin D.
Magnesium.
Magnesium, calcium, gym, things like that. Now, my biggest thing, and I don't know why we don't do it enough, I think we should call menopause and perimenopause hormone deficiency because that's what it is. And it has significant health risks. We all know that already, right? Why don't we replace what we're not making anymore? We replace other hormones that we don't make. Why not replace them? So I think bioidentical in particular because they're molecularly exact to what we were making before. They're plant-derived, and that, reduce your risk for all the things that we just talked about. Quality of life's going to be better. So I would just recommend replacing it.
And too, especially with bioidentical, it's so personalized to the person. We do a full blood work. Like you talk about your thyroid, full sex hormones. And then we talk to the patient. Well, you guys talk to patients. I do not. But you guys, as providers, talk to the patients, which it's so sad because that's what healthcare is. And I feel like we've gone so far from that. So really seeing how does the patient feel? What are their symptoms? What is their lifestyle? And being able to help with that full picture.
I think that's probably the most important. I mean, yes, labs, we need those, right? But you have got to talk to your patients because one size does not fit all. And everyone comes to you. They know their body than I do. Their level might look great to me, but that's not their normal. Yeah. So I think we, as providers, need to learn to listen and have a conversation with our patients again. So they will always tell you if you listen.
Yeah. I think too what you just said, we all know our bodies so much. That's who we are, right? But I think the world's so loud. Sometimes it's hard to listen to yourself and to remind yourself wait, I know how I should feel and having a provider to listen to that.
Yeah. And sometimes that's all they need. It's somebody to tell them you're not crazy. This is a real thing. You're not making it up. You're not too young. You're not too old.
Exactly. I've always been so worried about postpartum because you just hear all the things. And now I'm without Optimal Bio, I would have had no idea, one, the importance of hormones, what happens during pregnancy, what happens postpartum. Not going to say that it's going to be easier, but at least mentally I'll know, oh, this is why I feel like this. I think sometimes half the battle is just knowing so that you don't think you're crazy, or then you go to the doctor and you're kind of told that. And so then it just adds such negative ripple effect.
I think we just need to go back to actually listening to our listening to our patients, not just reading a piece of paper saying this is standard of care. And I mean, there's place, but we need to adjust according.
Agreed. Like you said, you think we should call menopause, perimenopause, hormone deficiency. That right there, one takes okay, this is what's going on. So how can we fix it? I think when there's just a label of, oh, menopause, oh, perimenopause, oh, you're a woman, you're going to go through that.
Exactly. As soon as it has to do with a woman, they're like, oh, it's normal. It'll be fine.
But then saying, no, this is hormone deficiency. So like you said, diabetics, we give you insulin. So why would we not give you back what's going on? And then it makes it tangible. Oh, I'm losing my hormone. This is what's happening. And this is what I can do to fix it.
Exactly.
Yeah. Yeah, I think if guys went through menopause, it'd be a whole nother conversation.
I 100% agree.
Yes. Women are not small men. We're very different.
100%.
Our bodies work differently. All of it.
We cannot just adjust. Oh, just let's go this a little bit lower. No.
Especially when we go back to the beginning of our conversation, that our hormones are fluctuating every single day.
Every day.
Every day.
It's when I talk to my patients and I'm talking about the hypothalamus, pituitary, gonad. When I'm talking to the men, it's pretty, here we go, estrogen comes back. And I tell every single female, this is the way it works basically. Estrogen is kind of what goes back and regulates. But Ours is much more complex because where you're at in your cycle plays a huge role. So,
and I think too, though, like learning more about, say, starting with the cycle, like women's health, and then you can build. So then there are so many things that you can do lifestyle wise to help with symptoms or help prevent, which I think it makes me feel better, right? You can do some control to feel better. But I think starting with knowing, and like girls, like we don't learn about our cycle. Like I know more in my 20s because I started researching it, not 15 years after. But I think just really the education piece helps so much.
I think that's key, honestly. Like we just need to educate in general.
Yeah, I mean, how many women do you see every day that on paper have gone through like the full cycle, right? They've had children. Now they may be perimenopause or some are postmenopause, and they have no idea how their body works because we were never taught that.
I would say probably 75% at least. I mean, just the little things like testosterone, just anything, they're like, oh, I wish somebody would have told me that sooner.
Right? Exactly.
I just think that it's important for women to know that they need to advocate for themselves. They're not crazy. That's just a real thing. There are some studies, but just find a provider who's going to listen.
And to just really understanding all those symptoms you listed, but to really being able to protect your brain, protect your heart, protect your bones. The inflammation, so key.
Inflammation, of course. Yeah.
I know. I talk about inflammation all the time. People are like, why? I'm like, it is the root cause of, I would say, all chronic diseases, all cancers. Yes. I'm like, how can I got a grounding mat the other day, but like, I'm like, I don't know if this is going to work. It's going to work 4%, but anything I can do to reduce my inflammation, I'm going to do it. Yeah.
I mean, we know it now. Like, they're doing this. It's just inflammation.
And that's why food is so important, because food can either cause inflammation or decrease it.
That is definitely, that's key. Our meats and our dairy, all the added hormones. And
I think the positive of all social media and Google these days is there is a lot of information that you can learn on your own, which is super helpful.
I do think that social media is great, but I think that you got to do your own research behind it sometimes.
Curate your own social media. Yeah.
I would do that. Because some things I hear and see and I'm like, oh, I don't know about that.
I know. So just do a little research, like, okay, where did this person come from? Who were they getting paid by? And then it usually all makes sense. Yep.
Exactly.
Well, thank you. This was so helpful and excited to talk about more women's health as we go on.
Thank you.
This has been a production of Optimal Bio. Optimal Bio is CEO Tyler Brannon, Medical Director Greg Brannon, podcast host Tyler Brannon, production assistance by Core Media, Beth Grabencourt, Administrator, Kevin Duthu, Executive Producer. The podcast can be found on our website, optimalbio.com, on Apple Podcasts and Spotify. Our theme song is Sunwave by Paradiso, provided by Epidemic Sound.